It is Wellness Wednesday, and this month we are continuing our theme this Wellness Wednesday of breast cancer awareness for the month of October. Dr. Sagun Shrestha is here back in our studio with us this afternoon to talk specifically about a certain gene, BRCA gene. So for people who have not heard of that breast cancer gene, exactly what is it?
Everyone is born with a BRCA gene, but only the people who have the mutations can develop different kind of cancers. Specifically, we know more about breast cancer and ovarian cancer related with it.
So it's kind of a genetic mutation.
Yes.
And it's passed down hereditarily?
Yes.
What are some of the things that people should, if they're thinking, okay, am I at risk for it? What are some of the things, the characteristics of our own background that we can kind of look into?
Most important is if someone comes up with a breast cancer, it's not that everyone will have a genetic mutation leading to the breast cancer. Because when you talk about breast cancer, approximately less than 10% actually have underlying hereditary condition. So we have certain things we look at and decide when do we need the genetic testing to be done for breast cancer patients.
And what are some of those things? I know family members who maybe had cancer at a young age, or a family member who has had more than one type of cancer?
Right. So if a patient comes in with, gets diagnosed with breast cancer, and if they are less than 50 years of age, those are the ones who need to have a genetic counseling done or genetic testing done. Or if someone comes with a breast cancer who has triple negative breast cancer, what is when they have the estrogen, progesterone, and HER2 negative, or triple negative, which are more aggressive, they need to have genetic testing done if they are less than 65 years of age. Or male breast cancer patients, they need to have genetic testing done. Or if they have a family history where they have first or secondary relatives with breast cancer, like if someone has their mother, sister, brother having breast cancer, so those patients need to have genetic testing done.
What about ancestry? Does that play a big role?
I know we see a lot of people going and doing the ancestry test, but in the ancestry test, it's not all the testing like the BRCA, because just the BRCA mutation is not the only test leading to cause breast cancer. There are other genetic mutations which are not captured in that.
But we do know that African American ancestry is a little bit higher of a risk.
Yes.
Okay, so if a patient does test positive, does that really mean that their immediate family is at risk?
Not necessarily. So when you have someone, a breast cancer patient is diagnosed and then they have the BRCA mutation, we tell the family members they should be tested too. They may or may not have the mutations, but if they have, then they are more empowered to make the decisions about what next to do, what are the prophylactic management they can do in terms of screening tests, getting it earlier, or having a mastectomy done, or having oophorectomy done. Those are things to prevent the cancer from happening.
All right, this is certainly something we can't talk about enough, beyond conversations that should be had beyond October. Thank you so much, Dr. Shrestha, for joining us
Thank you for having me
this afternoon.